Hello, I'm Phil Mollen, energy psychotherapist and member of the rather wonderful ACEP, Association for Comprehensive Energy Psychology. And I've been guided recently to take a particular interest in Mast Cell Activation Syndrome, MCAS, which I think is very important and probably is rather common, much more common than generally recognized. And if you suffer from a multiplicity of different physical and emotional, mental symptoms, phenomena, it may well be that MCAS is the core to all of this. So I'm going to just explain briefly a little bit about Mast Cell Activation Syndrome as far as I understand it, and I'm going to list some of the symptoms that can arise from that, and then I'm going to present a little Blue Diamond energy healing exercise, which I hope may be of some assistance. Okay, so here's a bit about the background to this. Many years ago, when I worked in the British National Health Service as a psychotherapist, I would sometimes encounter patients who'd suffered severe and repeated abuse trauma in childhood. And what I noticed was that in addition to their understandable and expected psychological difficulties such as chronic developmental PTSD and so forth, they often had many and diverse physical health problems. Some displayed multiple chemical and environmental sensitivities and allergy type responses. Some had autoimmune conditions. Fibromyalgia and chronic fatigue were common, as were irritable bowel syndrome and gastro-intestinal problems. My psychotherapeutic efforts at the time, that included EMDR, did not seem to improve these physical problems. At the time, I did not really know how to understand the link between these different types and levels of phenomena. And of course, conventional medicine would have the concept of psychosomatic illness, but that term did not really explain very much. Now I recognize that such people are probably suffering from Mast Cell Activation Syndrome, which is a relatively recently recognized condition. An official ICD-10 diagnosis for this was given in 2016. It's a condition involving mast cells, which are a form of white blood cell involved in the immune system. They can be regarded, these mast cells, as analogous to the first responders in an emergency situation. They identify invaders and initiate a defensive response through the release of histamines and cytokines and many other mediators of stress and allergy-like responses. But sometimes these mast cells become overactive, resulting in widespread inflammation and symptoms that can occur in almost every system of the body and brain. Mast cells are particularly prominent in the gut, the skin, and the respiratory tract. So these are all the areas that are at the boundary of the inner body and the outer environment, which is appropriate for the mast cells that act essentially like border guards. But they're also present more or less everywhere in the body and brain. And once the mast cells are overactive, they can start causing reactions to all manner of stimuli, and even to sensory and kinesthetic sensations. Now, as well as the physical symptoms, there can be effects on the brain, causing disorders of cognition, mood, anxiety. Sometimes phenomena similar to some symptoms found on the autistic spectrum, and sometimes even psychosis. A group of researchers in Finland successfully treated some patients with schizophrenia simply by giving high dosages of an antihistamine drug, thereby countering the action of mast cells and reducing inflammation. Although this is not yet established as an effective and safe treatment, so it's not actually available as a treatment for psychosis. Now, good sources of further information about MCAS are videos and articles by Dr. Anne, with an E, Maitland, Maitland. There's also a good website, mastcellaction.org, and many other resources and books that you can find by searching. Now, those who write about MCAS usually draw attention to the range of triggers for this condition and the importance of identifying these. However, they mostly do not seem to recognize the role of trauma. The knowledge from energy psychology provides important insights, where for 30 years or more it's been commonplace to use energy calming methods to treat environmental and nutritional sensitivities. We realize in this field of energy psychology that the body-mind energy system does not distinguish between physical and mental or emotional injury. It all registers as injury, danger, and toxicity. I think this is why physical trauma and stress and toxins and viruses and parasites and pathogens entering the body, such as COVID, flu, Epstein-Barr, Lyme, as well as emotional pain, can all be triggers for Mast Cell Activation Syndrome. And when people have been subject to extensive abuse, trauma from caregivers, resulting in pervasive feelings of betrayal, their system may come to register almost the entire world as toxic and will maintain a constant state of high anxiety, high alert. It may also be that this condition can result from severe and extensive birth trauma, prolonged or difficult birth experiences, or early medical trauma. Whatever overwhelms the coping capacities of the mind-body energy system, which is one definition of trauma, has the potential to trigger MCAS. And once MCAS is established, it can result in increasing sensitivity to more triggers, whether these are chemical, biological, or emotional. And the spiraling positive feedback will result in a worsening condition with physical reactions to stress and all manner of environmental, nutritional, and interpersonal stimuli. And symptoms of MCAS may come and go or vary in intensity according to how active the mast cells are. Here are some of the common symptoms that can be a feature of MCAS. So first, multiple food, drug, chemical and environmental sensitivities, allergy type responses, sometimes severe, chronic fatigue, generally feeling unwell, fibromyalgia, general pain in bones and joints. There can be a link with hypermobility and Ehlers-Danlos syndrome, skin irritations of various kinds, heart inflammation, racing heart, palpitations, feeling faint, POTS, when not clearly linked to other diagnosed heart disease, of course, feeling dizzy and faint, gastro-intestinal problems of various kinds, effects on the brain fog, cognitive difficulties, headaches, migraine, depression, anxiety, insomnia, eye inflammation, disturbances in the reproductive system in both men and women, autoimmune disorders of various kinds. Many serious illnesses may be expressions of or exacerbated by MCAS. Of course, other factors may cause or contribute to any of these conditions. There is another phenomenon known to energy psychologists who have studied Callahan techniques. This is that certain stimuli can function as energy toxins, creating reversals in the subtle energy system. Unlike the psychological reversals that are motivated by fear, guilt, identity, or secondary gain, and so forth, this kind of systemic reversal in the whole system is a direct response to the toxic stimulus, which causes confusion and switching of emotional signals, so that good registers as bad and bad registers as good. The system becomes, in a sense, perverted with a reversal of the body's morality, as John Diamond once put it, a psychiatrist. It seems likely that this confusion of the immune system, no longer able to discern accurately what is good and what is bad, may play a part in MCAS. And an energy system that is in reverse or scrambled may register the entire world as toxic. States of severe suicidal depression always, in my experience, register as energetically reversed. It is an energetic state that has turned against life, against the person. The person no longer experiences the world as nurturing or as supportive of his or her life. Such a state of depression often follows a period of significant trauma, stress or emotional pain that has left the person feeling devastated or deeply undermined. I hypothesize that the multiple stress hormones triggered by the mast cells can create an energetically toxic internal environment, throwing the whole system into reverse, and thus clinical depression is a kind of severe psychosomatic illness. So I'm currently exploring in what way energy psychotherapy methods, including blue diamond healing, can help alleviate MCAS. And I've devised the following blue diamond exercise or meditation that I hope may be of help in calming the body-mind energy system and allowing the danger signal to switch off when appropriate, enabling feelings of safety to switch on when appropriate, and also to heal the perturbations inherent in being in a physical form. This is not a substitute for medical advice or assistance, of course, but it is intended merely as a meditative orientation towards health and well-being. So I'd now like to invite you to join me in this blue diamond exercise. Some of you will be familiar with some of the basic blue diamond procedures. There's a special blue diamond energy center, healing center, just under the collarbones, just under where a man's tie knot would be, in the center under the collarbones. So just rest a couple of fingers there, and the other hand can rest on your heart chakra energy center, center of your chest, just underneath. Now this blue diamond, just allow the image of it to be however it appears to you. Blue and crystalline, shimmering with silver rainbow frequencies. And just think of your consciousness entering this blue diamond field. And you can bring anything that troubles you into this blue diamond field for healing, guidance and resolution in whatever is the optimum way. And we're going to focus particularly on calming the system, calming the mast cells, and evoking the safety system where appropriate. And so now, with an exhalation of the breath, send a copy of the blue diamond straight up into the far distance above with a poof, where it becomes a huge clockwise spinning sphere of shimmering blue and silver rainbow energy that's spiraling clockwise down around you. The clockwise direction you can register easily as it spins down clockwise around you into the earth. See it going down clockwise into the earth. And then with another exhalation of the breath, send another copy of the blue diamond down into the core of the earth, where it becomes a huge counterclockwise swirling vortex at Earth's core, spinning up and around you counterclockwise, drawing out all of the waste, all that is toxic, all that is false, distorted, degraded, corrupted, deceptive, or dysfunctional. These two counter-rotating spinning fields, bringing in fresh energy and taking out the waste. And think of yourself now as a vast column of light, silvery rainbow light, with these two counter-rotating spinning fields, a vast column of light. And know yourself as a tree of life, tree of life. And now just allow these thoughts to permeate your system without any effort, no struggle, just let these thoughts be there. Doesn't matter if you react against them, just let them be there. Life flows through me, and I receive life energy as I also eliminate waste. I am part of the flow of life. I surrender to the flow of life. All my resistances to the flow of life are healing now. Now we're going to do something to heal the original trauma of incarnating into a physical form. And we're going to flash, as I call it, flash 2 particular energy centers. The first one, number 1, an energy center just a little way beneath your feet, but also linking deep into the earth. And at the count of 5, there will be a flash at this first energy center, a little way beneath your feet. 1, 2, 3, 4, flash. Just relax as the energies settle and reorganize. And we're going to flash another energy center, number 2, which is at your lower abdomen. So at the count of 5, there will be a flash at this energy center, number 2, at your lower abdomen. 1, 2, 3, 4, flash. And just relax as the energies settle and reorganize. And now allow these further thoughts to be there. My mast cells are in balance and are supporting me now. My mast cells and my entire immune system are programmed for my optimum health. I can live in comfort and health in this physical world. My body and my higher dimensional realms are in harmony and are evolving in an optimum way. My body and brain are entrained to my higher dimensional realms and to my true organic living code. Just let the energies settle and reorganize. And then gently bring your awareness back. Okay. I hope it's helpful. If it is, just put a comment in the fields below this video. I'm Phil Mullen. Thank you very much for watching this video.